பேசலாம்.
Good afternoon to everyone. A very warm and pleasant afternoon to everyone. Myself, Charu Hasini, President of the UBQ, take immense pleasure in welcoming you all for this national webinar on understanding the signs and symptoms of COVID-19. Prayer delights God's ears, it melts his heart, said philosopher Thomas Watson. So let us invoke the presence of Almighty as we begin this event.
सत्यात्मकं त्वां शरणं प्रपन्नाः वाणी गुणान् कथने श्रवणो कथायां हस्तौ च कर्मसु मनस्तव पादयोर्नः कृत्यां शिरस्तव निवास जगत्प्रणामे सृष्टिस्ततां दर्शने सुभवत्तनूनाम् नमो भगवते तस्मै कृष्णायाद्भुतकर्मणे रूपनाम विभेदेन जगत्क्रीडति यो यतः ॐ शान्ति शान्ति शान्ति.
It's a glad welcome we bring to you this afternoon, filled with the desire, hope, and dreams we all share. I now request Dr. P.T. Srinivasan, Head of the Department of Biochemistry, to welcome the gathering. Please, sir.
Well, good evening. On behalf of DGVC College, and I like to welcome our chief guest, Dr. Sudhir Kumar, MD, Senior Consultant Neurologist from Apollo Hospital, who have given the consent to talk to our students and also to the participant regarding the national webinar on understanding the signs and symptoms of COVID-19 infection. Really, we are very happy to see you on screen, sir. Welcome you, sir. And also I like to welcome the faculty members of Biochemistry Department, Head of the Department, other participants, other faculty members for this webinar. So we know very well that for the past 8 to 9 months, we are facing a difficult problem in COVID. And also a lot of awareness have been created by the government of Tamil Nadu and government of India. But in spite of that, there is no concrete solution for avoiding the COVID. Still, we are following all the methods without whether it is correct or wrong. But anyhow, still we are following it very strictly, wearing a mask, sanitizing, keeping our surroundings clean, everything we are doing. But until we are getting the vaccine, we will not be very much comfortable. Once if the vaccine comes, automatically what will happen? Vaccine comes, but it will not be given to all the people. We have to continue the same process for next another 6 to 1 year. The people are telling, the medical team is telling that even the vaccine comes in the month of January or February, but we have to follow the same protocol for another 6 months to 1 year. So this is the input given by the medical team to the colleges and other places. And still today we have reopened the classes for PG science students, and we are going to reopen the classes for third year students on Monday. And still we find very difficult to call the youngsters inside the campus, because the most important thing in the COVID is அந்த வியாதி இருக்கிறவங்களுக்கு தெரியவே தெரியாது. அது வந்து யாருக்கு இருக்கும்னாக்கா most of the thing who is that peopleனாக்கா youngsters. If the age is above 40, the symptoms will comes out and for that we can get the treatment, we can be quarantined, and we will follow all our prevention. But when it comes to the youngsters, this will not known to others at all. So this is the great difficulties we are going to find. And today also my friend came from UK, and she told that second lockdown have started in UK. Here we are clearing all the lockdowns, but in UK what has happened? They have started the second lockdown, and they are telling that they are going to give the vaccine for the people also. I don't know what is happening in other countries also. So in this situation, the best thing is whatever the medical team tells. As a non-medical person like me, I am a computer science person. We have to follow strictly without telling whether it is right or wrong. We should not take whatever the medical team tell. We have to follow. Accordingly, we have called a medical person today for this webinar, and I think really you are going to get knowledge on this area. And in which, after getting all this knowledge, don't keep it with you. You share this information to the others in your hometown, in your neighbors. You share all this information to your neighbors, to your friends, and your relatives. With these words, once again, I will welcome one and all present here on behalf of DG Vaishnava College, Arumbakam, Chennai 106. Thank you very much. We can move for next.
Thank you so much, sir.
Mute பண்ணிருக்கமா, muted.
Great lives never go out.
Can you hear me, sir?
Yes.
Good afternoon, everyone. This is Sai Dashmi from second grade Biochemistry. Great life never may go out. Benjamin Harris. I now request Mrs. Maria Carolyn Rebello, Assistant Professor, Department of Biochemistry, to invite our honorable speaker.
Guest for today's webinar, Dr. Sudhir Kumar. Dr. Sudhir Kumar, a consultant neurologist at Apollo Hospitals, Hyderabad, has received his medical and neurology training, MBBS and MD Medicine and DM Neurology at Christian Medical College, Vellore during 1989 to 2001. He has worked as a lecturer and consultant neurologist in the same institute until 2004, till he left for Apollo Hospitals, Hyderabad. He is one of the youngest to qualify as a neurologist at the age of 28. He has an experience of over 20 years in managing patients with various neurological disorders. His areas of expertise include brain stroke, neurocritical care, epilepsy, neuropathic pain, dementia, and migraines. Dr. Kumar has over 120 published research papers in peer-reviewed national and international journals, along with multiple book chapters, monographs, paper presentations, and clinical trials. He has also published the first EEG atlas in the country, Atlas of Electroencephalography for adults and children. He is a regular speaker at national and international conferences and continuing medical education programs. He has worked as the head of clinical operations Maya Clinic, a California-based research organization, for several years. Dr. Kumar has been on the editorial board for Neurology India, Indian Journal of Critical Care Medicine, and International Journal of Neurology and Neurosurgery. Dr. Kumar is passionate about teaching. Several students of medicine have benefited from his classes as he simplifies the most complex subject of neurology in an easy way to comprehend. Dr. Sudhir is loved and admired by his patients, which include people not only from various parts of India, but also from the Middle East and Africa. It is a privilege to have you as the speaker for this day, sir. Welcome, sir. A humble note to the participants. Kindly mute your audio and video for effective presentation by the speaker. Over to you, Dr. Sudhir sir. Please, sir.
Yeah, thank you very much. And let me share the screen. Can you see my slide?
No, cannot seen, sir. Not coming, sir.
Not coming? Okay. No. I think now you can see my screen. Put the PowerPoint. Now can you see the slide?
Yes, sir. Yes, sir.
Okay.
Yes, sir.
Fine.
It's visible.
Sure. So I think now we are set to go. So I think thank you all of you for the invitation extended to me for talking on this relevant topic of COVID-19, and for all the nice words that you mentioned about me. I don't know how much I deserve, but anyway, I'm here. And I also understand that most of the people here are, who are in the audience and who have joined are not doctors. But this is something which, so I'll be talking about, this disease, which elevates most of the information is in the public domain. And because there is so much, when there is so much information, people tend to get confused. And also when there is a lot of information, it also means that, lot of it is unknown, because if things are known, we'll have only very limited information. So my job is today to, look at some of the basic things like signs and symptoms, and also try to understand, when somebody tells us to do something in COVID-19 to prevent the disease, or, do something, what is the basis for that? And to start off, what is this, this disease? So this COVID-19 disease, if you look at this term, it's a viral infection. So, viruses have been our enemies for long, right from earlier days of smallpox. Till date, only one viral disease we have managed to eliminate, and that is smallpox, which got eliminated after, but it took us 3,000 years to eliminate smallpox. And so when Corona came last year, people said, okay, let us do lockdown for 6 weeks and 12 weeks, and then Corona will disappear. It was never going to happen, because we have got many viruses have come to us, but till date, as I said, we have got rid of only one virus, and that is smallpox. And the second virus which we might get rid of in the near future is poliomyelitis. And I'm proud to share that a lot of the work behind polio eradication happened in the institute where I studied, that is CMC Vellore. We had stalwarts like Professor Jacob John, virologist, and Dr. Thomas Cherian, pediatrician, who were the brains behind this pulse polio program, which it was quite successful. And from India, we have got rid of polio, but we still have countries like Pakistan and Tanzania and Nigeria, where few cases of poliomyelitis keep happening. So that's the second viral infection. But there is no third viral disease which has come and gone. So in all likelihood, the coronavirus also, COVID-19 also is going to stay with us. So this is a virus. This virus is called SARS-CoV-2. And the full form of that is severe acute respiratory syndrome coronavirus 2. Why it's called coronavirus 2? Because we already have a coronavirus 1, which causes common flu, which we all suffer, what is called seasonal flu. We catch flu. And there is a vaccine also for that, but you should know that, the viruses mutate. And so if we take a vaccine once, we need to repeat again after a year. But I'm sure many of you may not be taking that vaccine. Today, Dr. Srinivasan told us that we're all waiting for the COVID vaccine. But I am sure that once the vaccine comes, by then already people have got, so relaxed. We see people walking around in public place without masks, they don't maintain social distancing. So this kind of, the fear is there more in the initial period. And then as we get familiar with the enemy is still the same powerful, equally powerful, but the fear reduces. And by the time we get vaccinated, maybe another 6 months or a year, by then, people may not feel that we need to take the vaccine, because the flu vaccine, which is there for so many years, very few take it, and it's not that the common flu doesn't kill. Common flu also kills about 0.1% compared to COVID-19, where the death rate can be about 1%. So 99% people recover, but there could be 1% who may die with this. And this disease is called COVID-19, and as you can see, the full form of this is coronavirus disease 2019. So COVID-19, that's how the names came of the virus and the disease. Now this virus, this picture you may have seen in many places. It if you look at this viral diagram, it looks like a fancy diagram. Many children also draw it. Looks like some kind of star, moon, then lots of spikes. Looks fascinating, but the green stuff is the one which you see, what is called spike protein, and that is what is used by the virus to attach to the different organs where it involves. And as you know, it's a respiratory infection. So the common thing is it causes pneumonia, and the virus will enter through the through nose, mouth, or eyes, and mainly through the nose, and then it will attach to the alveolar cells of the lungs by this spike protein, and then it causes pneumonia. And as we know that there are many other organs, and the receptor what it requires to attach is called ACE2, that is angiotensin converting enzyme 2, which is abundantly found in the lungs, but it is also found in the brain, kidneys, and heart, and that explains that it can affect other body parts also. So this is how the virus looks, the most dreaded virus currently. And so what are the unique features about this SARS-CoV-2? That's the name of the virus, as I told. So it can enter through the men. To remember these three things, mouth, eyes, and nose. So whenever we need to, if you need to prevent the infection, we need to cover these three parts from in as many people as possible. If it is universally done, then we can stop the transmission. That's the only method of completely stopping the transmission. Then I said this virus has a special affinity to this receptor called angiotensin converting enzyme 2, ACE2 receptors, which are commonly found in lungs, and that's why the commonest disease caused by COVID is pneumonia or the lung infection. And it is also, these receptors are also found in the heart, kidneys, and the digestive tract. So you'll hear about people having myocarditis, that is called inflammation of the heart, kidney damage, and also digestive tract symptoms like diarrhea or other stomach related issues can also happen with that. And then one more thing to remember is that viral replication is the method by which the viruses multiply in our body once they enter. It is the fastest in the first week, and so the risk of transmission from one person to another is also the highest in the first week, and also the likelihood of getting the symptoms due to the virus infection is also highest in the first week. The replication slows down in the second week, and by third week it's almost nil, close to nil. And then how it happens is when the viruses enter our body, we try to kill the virus, and that happens by antibody formation. And we have two types of antibodies which are used to fight the viruses. They are IgG and IgM antibodies, and they do not develop in the first 2 weeks. So this is important because many times we do two types of testing. One testing is done what is called as the commonly swab test, that is done by RT-PCR. So that looks at the actual virus. So that can be done anytime, as early as possible. But if you are doing any antibody-based testing, there's no point doing it in the first 2 weeks. So wait for the third week or even fourth week. That's when the antibody levels will be high. And then, and antibodies means that we have already recovered from the infection and our body has got adequate immunity against the infection. It is also useful, when we want to do what is called plasma therapy. So if a person has already recovered from COVID, that person will have antibodies, and that person's plasma can be given to another person who has active infection, and it can help the person recover from the infection. So again, that depends on the antibody levels. If antibody levels are higher, that plasma is more effective. One more point about viral replication is the age factor. So the viruses multiply rapidly in older people, and that is how you must have heard that the older people are at much higher risk of getting severe disease. And the reason for that, it's not the age factor. It's not just the number of the years the person has. It's just that in older people, viruses multiply much rapidly, and that's why more severe disease in the elderly. So these are some of the unique features which we should remember, not commonly mentioned in many places. Other point I want to highlight is the incubation period. So this term means that once the viruses enter the body, immediately people may not get the symptoms. So suppose I get exposed to the virus today, I may not have the symptoms now, but it may take a few days for me to develop the symptom. And that period between the entry of virus in the body and development of symptoms, that is called incubation period. For COVID-19, it ranges from 1 day, as little as 1 day, up to 12.5 days. And most people will get symptoms in 5 to 6 days, but it can take up to 14 days also. So now this will explain to you, always when somebody says, oh, today I got exposed to a person who was COVID positive, So I'm going into quarantine, and that quarantine is always 14 days. The reason for that is that even if I don't have a symptom today, I could develop it up to 14 days. So once somebody gets exposed to a known person who's COVID positive, then they should be isolated for about 2 weeks so that they don't spread it to the third person. And the basis for that is incubation period of up to two weeks. Now, how does coronavirus spread? This is important for us to know, because only if we know, we can, halt the spread or limit the spread of coronavirus. So the most important is person to person, because if one person has infection, he can give it to the next person. And as I mentioned, that the viruses need to exit the body. So exiting can happen from eyes, nose, or mouth. So as you can know, if because it's a commonly respiratory infection, the person can sneeze or cough, and so from the mouth and nose the viruses can come out. And while talking also, we may not realize, but while talking also, many droplets keep coming out from our body. And so any of these situations can release the viruses from the person's body. And this can be kept if the person is in close contact with somebody else, like family member or colleague in the office. So the same virus particles can be inhaled by the people who are nearby, and that is what is we can prevent by what is called maintaining safe social distancing. So if you are in the close range, then directly as the person sneezes, other person can inhale and get infected. But we should also remember that these aerosols, which contain the virus particles, it can hang in the air for 3 hours. And we know that today most of the schools, colleges, offices, cinema halls, metros, many places are totally closed and compact. And if a infected person had been there in that room or in that place earlier, even if that person has left that room or that place, the viruses can be there for 3 hours, and then it can be a source of infection. So if you're in any public place, or if so it's better to have a mask on. At least that will limit the number of viruses that can come out if the mask is on. Second thing to remember is touching the surface, because many times these aerosols from the air, it can fall on the table, chair, or anything which is touched. Or the person who is infected, the infection can be on his hand, and when he touches something, the viruses can be found there. So that's the other thing to remember, where when we touch any surface which is not known, not known to us, it could be a potential source of infection, and that is the reason why people need to sanitize. So now you can understand why we need to wear a mask so that the viruses don't come out from our body, from the nose and the mouth. So we need to cover the nose as well as the mouth. Then second thing is when in the aerosols also can be in the air, so to prevent that, and also maintaining a distance so that viruses don't enter our body. And then avoiding to touch anything as much as possible. And if you have touched, then better to sanitize the hand after that. Kissing also can transmit coronavirus because of the same droplets can spread. Whereas as of now, sex is not known to spread the virus. Now then one more thing is, we rely so much on the testing, because the moment, in the initial days when India had lesser numbers of COVID compared to Europe and US, the one criticism always was that because you are testing less number of people, so you are getting lesser positivity. But the test is not gold standard. If you look at this testing, what we do for COVID, the most widely used test is called RT-PCR, which is reverse transcriptase polymerase chain reaction, and it's done on the nasopharyngeal swab. It's a little painful. They have to insert the swab, take it from the nose or the mouth, but that's the commonest method. And there is a term called as false negative. What it means is that even if the person has got the virus disease, the test shows negative, and that can give a false sense of relief to the person. So somebody gets tested, the test is declared negative, then the person carries that report all over the place, and if you see, I have been tested, I am negative, so I can I can roam around, I can go for this function, I can go for this party and everything. But you should remember that the false negative rates for SARS-CoV-2 COVID-19 by this RT-PCR test can be very high. And if you do it in the first 5 days after exposure to the virus, up to 2/3, that is, out of every 3 persons, 2 can be negative. So the person has the disease, but they're still negative. And even after we do at day 8, the negativity, it decreases, but still about 21% can be negative. So they have the disease, but the test shows negative. Now see, if a test shows positive, then the person is quarantined and staying at home or hospital, wherever the case may be. But those who are having disease and the test says negative, they become careless. So they roam around and they can meet 10, 15, 20 people also, and putting a major risk on them. So what we have to remember is that if somebody has got exposed to a person who is known to have COVID-19, even if the test is negative, it is better to quarantine for about 2 weeks, or maybe repeat the test after a week, especially if you have done the test in the first 5 days. Then after 3 or 4 days, again we can recheck the test. And so what we have to remember is that if a test is negative, it does not rule out COVID-19. And sometimes when there are minor symptoms of respiratory symptoms, if you do a CT scan of the chest, we can also pick up the pneumonia, which is very typically diagnosed by the CT scans. One more major problem what we face is the huge number of asymptomatic COVID-19 infection. Now, when I say COVID-19 and no symptoms, you should say why it's a problem. It's a relief because person has the disease and no symptoms. Yeah, I agree, it's a relief. It's a relief for the person who has no symptoms, but that person also can be a source to spread the infection to others, and this can be seen 1 in 5 infected people. So if let's say there are 100 people who get the COVID-19 infection, about 20 of them will not have symptoms at any point of time, in the beginning also, in the middle also, and later also. There are a group of people who, to start off, they don't have symptoms, but after 4 or 5 days or 6 days, they may start getting symptoms. Then we don't call them asymptomatic, we can call them mildly symptomatic. So, but one point of relief is that the risk of transmission of infection is 42% lower from the people who do not have symptoms as compared to those who have symptoms, possibly because the viral load in those without symptoms may be lower. Okay, and so this is the basis for universal masking. You may ask, I have no symptoms, I am totally fine, why I should wear a mask in public? So you could be one of those 20% people who have the virus but not showing any symptoms. And I said doing a testing also may not help much, because test also can be negative in about 21%. So these 20% people can have no symptoms and the test also can come negative. So everybody has to wear a mask, because we don't know who that 20% group are who could be let loose, and that can be even if the corona graph is coming down, again the graphs can go up because of this careless behavior of this 20% people who may not wear the mask. Now at this point the question is very, very logical question comes to mind. Same virus, same, and all humans are same almost, they look the same, height, weight, age, everything is same. Why someone gets no symptoms and why somebody gets such a severe disease that he may die also? What causes all this wide variation in the presentation? The same infection, why the outcomes are so much different? So for that there are two main reasons. One thing is I already mentioned that our bodies tries to fight the infection, and this fight against COVID is by what is called interferon response. So when the virus enters our body produces interferons, and they fight against the COVID. But in some people, they have own antibodies, they attack and neutralize interferons. So interferons, they are formed that they should fight the COVID virus, but their own antibodies neutralize the interferons. So interferons are not left to fight the virus. And in some other people, there could be a genetic mutation which can prevent the production of certain types of interferon which may be required to fight COVID. So this is one of the major reasons. And second thing is just the opposite. So our immune system should be adequate, not over. Any good thing also should not be too much. Bad things or good things should be in the correct proportion. If we get too much of good also can be it may not be beneficial, and that is true for infections also. So once the infection comes, our immune system should just kill the viruses and then stop. But in some people, immune system does not turn off even after infection is controlled, and this can lead to intense and widespread inflammation all across the body, all over the body, many body systems, like in the lungs they get what is called ARDS. So the virus has gone, there's no longer virus is there, but let's say if we have 10, I'm just giving example, if we have 10 viruses, let's say we need 10 antibodies, so we finish all the 10 viruses, but instead of 10 we get 10,000 antibodies. So these antibodies, they not only have destroyed the viruses, they start damaging our own different organs like lungs, heart, kidneys, brain, and that situation is called cytokine storm. You may have heard of this, and this is a situation where we have to use drugs like steroids. You must have read in the newspapers that steroid is a life-saving drug, in COVID, and especially in a person where we are seeing this kind of immune system, going out of control and trying to damage your own tissues. There, steroids are very useful, but we have to be very judicious. Many times I see, doctors prescribing steroids in the first few days itself when infection is still active. We know that if we use steroids in the active infection stage, the infection can flare up, and infection also can, kill. So we have to time the steroids nicely. So it should not be in the first 5 days. Usually this cytokine storm will happen in the second week only, when the antibody response is more. And so that is the so now you can understand why there is wide variation. So one is the inadequate interferon response in some, and the second is immune system going out of control in some. Now looking at some of the common symptoms of COVID-19, we already know fever, like any flu can cause fever. Cough is usually dry cough, not with sputum. People feel fatigued, they feel very weak. And like any infection, they have loss of appetite. One typical feature can be loss of smell also. And again, this can happen in any viral infection. It is typically seen in COVID-19 also, and body aches are also very common. In severe cases, they get high fever, severe cough, shortness of breath. So all these things suggest that it's a pneumonia. And ACE2 receptors, as I mentioned, they are mainly found in the lungs, and route of entry being nose. It explains the mainly patients having respiratory symptoms. So these are the typical symptoms when somebody has. They should get tested or suspect that it could be COVID. Being a neurologist, I see a lot of patients who have neurological symptoms also, and in that muscle pains, headaches, body pains, loss of smell and taste, they are common symptoms. Serious symptoms are not common, like fits, stroke means paralysis, brain fever, people coming in little unconscious state. Bell's palsy is the paralysis of one half of the face, and GBS is a condition where nerves of the hands and legs get affected, and they come with weakness of hands and legs. Good thing is that once we diagnose all these conditions and treat them, most of them will recover. And why the nervous system gets involved? One is the virus enters from the nose, and from the nose we have this olfactory nerve which gives us smell. They enter the brain, through the bone, and viruses can also enter through the olfactory nerve into the brain and cause meningitis. And second, I already mentioned inflammatory response, antibodies which are meant to kill the viruses, they are too much, and then those antibodies can harm the brain tissue also. And one more typical thing happens is thrombosis. So thrombosis means, this virus infection of COVID, it makes the blood more thick. You must have heard of things like D-dimer, the test which is done, so the blood becomes thicker and the blood can clot. And if clotting happens in the brain, it leads to thrombosis, and paralysis can also happen. Now, few things about what are the risk factors that make a person get more severe form of COVID-19. Age, I already mentioned. Older age, the viruses multiply much faster, so it's a risk factor. Male gender, almost if you look at any data of COVID-19, 2/3 of the victims or patients are males, and that also true for deaths. If you look at, let's say, 100 people dying of COVID, about 2/3 are males and 1/3 only female. So this is one disease which is kinder to female gender, unlike many other conditions which are more severe in women. Especially autoimmune diseases are more common in women, and things like that. But here the main reason for this is the immune system of women is much stronger, and if you go into the reasons for that, the genes for the immunity is located on X chromosome, and as you know, women have 2 X chromosomes compared to men who have only 1 X chromosome. That is one of the factors. And of course, we should give the credit to women who follow the rules much more. If you look at any kind of thing where rules are need to be followed and not to be broken, whether it's road traffic accidents or driving under influence of alcohol, all these rules are broken more by males. And so, compliance like, wearing mask, maintaining social distancing, use of sanitizers, possibly all these, behaviors are much more common in women than men. And also possibly women need to go out much lesser as compared to men. That could be another risk factor. Diabetes is a risk factor, we know reasons, because diabetes reduces our immunity, and so any infection can be more. Hypertension, heart or lung disease. Obviously, if somebody already has a lung disease, another disease happens like pneumonia due to COVID, the morbidity will be much more. Obesity, again, obese people, they don't recover well from many illnesses. COVID also is one of them. Cancer also reduces immunity, so infections are more. And there are many people who take immunosuppressive drugs, like after kidney transplant or liver transplant, or people who have arthritis, they may need medication. So when the immune system is low, then they can get infections much more commonly. So this is the point I already mentioned. So men have more serious disease of COVID, higher deaths, and I think this point I already covered. So we'll skip this. And I was mentioning about this risk of thrombosis. So this is one of the unique features of COVID-19 is that the risk of clot formation is high, and this can be explained by in the blood. If you do the test like D-dimer and fibrinogen, these levels are higher, and that explains the high risk of clotting. And clotting can happen in the lung veins, causing pulmonary embolism. If it happens in the brain, causes ischemic strokes and paralysis. And brain veins can also have clotting, and again that can lead to headaches and fits. And sometimes in the calf muscles, the veins can clot, and that is called DVT or deep vein thrombosis of the legs. And obviously, when people have more severe COVID disease, the risk of thrombosis also is much higher. And that is the basis why we need to use anticoagulation drugs like heparin, or now we have newer drugs, Dabigat, and many other drugs are there which can be utilized when we suspect thrombosis. Or in severe cases, we can use prophylactic also to prevent clotting. And this is one point I just want to highlight. I already mentioned briefly. So the part of damage in COVID happens because of the direct infection. And second thing I mentioned, some people's immune system goes out of control, and mainly at that time inflammatory mediators become very high. So mainly we have drugs like compounds like cytokines and chemokines in the blood, mainly interleukins. And of all this, there are many of them I mentioned here, and the most important of them is interleukin-6. This causes massive inflammation, and that is why if we have medicines that can reduce inflammation, it can save lives. I already mentioned the role of steroids in that, but in some people the inflammation can be much more severe. Even steroids don't work, and there we have drugs like tocilizumab, which is a specific interleukin-6 receptor antagonist, and in some people this has been found to be useful. So now you understand, that other than infection, inflammation also plays a role in the disease. And thrombosis, clot formation. So infection, inflammation, and clot formation. These are three things that can happen in COVID and cause various symptoms. So I think with this, I will come to a close, and then maybe if there could be some interaction also. So it's a viral disease, highly contagious, and even though people are less scared, but the infection rate has not reduced. So we still need to be cautious. And case loads are high. We still need to follow the SMS precaution, that is social distancing, masks, and sanitizer use need to be continued. And symptoms occur due to three effects of the viruses. That is, one is the direct effect of the viruses, inflammation due to excess antibody production, and thrombosis because of the clot formation. And symptoms vary. It can be no symptoms, mild symptoms, or severe symptoms. And testing is useful, but we should not, take it as a passport saying that, okay, my test is negative, so I can roam around. No, we still need to take precaution. And one more thing comes to our mind: if somebody has already recovered from COVID, will they get second infection or not? So far the data says that second infection is not common. We have few reports, but that 9 months or 10 months or 1 year period is not enough. So possibly in such a short time, second infection may not happen because antibody levels are still high. So once antibodies decline, then at that stage it may happen. But I think it's still important to follow the precaution. And as I said, negative test does not exclude COVID. So this, I think, is the last slide. And with this, we come to the end of my presentation. But I think if any questions or comments are there, possibly we could take that.
Thank you, Dr. Sudhir. I couldn't log in the beginning due to some technical issues. So I missed the initial part of my role. So that's why I thought I'll just come in now. Anyway, thank you for that wonderful content of the talk. I was wondering, you are going to address the science graduates. So I was wondering whether the students will be able to come up to your level, but fortunately you have understood the audience and you have prepared the content in such a way that it was very nice and lucid, and we are able to, I feel most of my students will feel confident that they have understood something from today's webinar. It's really nice. I should thank you very much for that understanding and preparing the content accordingly. Thank you very much for that. So before going into the audience question, I have a couple of doubts regarding this COVID issue. The first one is, if the COVID happens to enter the body through some other parts, say from a wound or a cut, is there a possibility of COVID virus infecting other parts of the body? If so, what are the symptoms, or I mean, what are the consequences of that?
I think it's a very, very brilliant question, because it can, theoretically it's possible, but as of now, the viruses they have not been shown to enter from the wound, because possibly, as I said, the viruses, they need this ACE2 receptors, angiotensin converting enzyme receptors, and I showed the structure where there is spike protein.
Yes.
So that protein binds to these receptors. So only those organs where these ACE2 receptors are there, the viruses can enter. And the wound can be there only on the skin, and luckily our skin doesn't have ACE2 receptors. So let the viruses be there. All the time viruses, I think all over my hands viruses may be there now, because sitting in the hospital. Okay. But they cannot enter through that, even if the wound is there. But if I use this hand and rub my nose, or so eyes, nose and mouth, MEN, that there are only 3 ports of entry. And then people have also looked at whether it can happen through sexual intercourse, like many viruses like HIV and hepatitis B can enter. Yeah. In that also, so far the data says that through sexual intercourse, if somebody is COVID infected, it cannot enter. But of course, if there is a kissing involved, then it can enter through again nose and mouth. The viruses can enter.
Thank you for that wonderful. That ACE2 receptor point is a very scientifically crucial point. Yeah, my next question on the very common doubt regarding this COVID is, see, the confirmatory diagnostic test, like whether they say RT-PCR or ELISA or whatever, it seems to be, for my understanding, that the test is not so 100% confirmatory, 100% true positive. So if this is the situation, then what does the statistics of so many positive cases every day getting reported throughout the world means?
Yes, I think again it's a very, very useful and very important question. So, those total numbers, when we say in Tamil Nadu has got so many numbers, Telangana got so many numbers, India got, so these numbers do not mean much, should not mean much to people like you and me or the general public. See, people who make policies, like government of, Tamil Nadu or government of India, so they need to have some kind of, data, when they start, let's say when they say they need to implement something, so many clinics, they need to arrange so many beds. So for them it matters that, okay, if a state like Tamil Nadu will have 10,000 new cases, out of that 1,000 will be having severe infection. So that means we need 1,000 beds on a daily basis. So for them it matters. But when people like us, we switch on the TV and then we are looking at the headlines, so many cases, all the time they are showing in the beginning. And so that doesn't mean anything. If you look at this, there's no other disease for which we have this kind of statistics in the public domain. If I just, if I happen to tell you that, a common disease like TB, tuberculosis, which is, our enemy number 1, TB kills 1,250 people on daily basis in India.
Then why are we scared of COVID?
Exactly, because, TB, when you say people, there is something called TB, which kills 30 times more number of people than COVID on a on a regular basis, and not only this year, for the last so many years, right from Alexander Fleming, when he discovered the first penicillin, TB was killer number 1. Then they discovered streptomycin, is still used today. So what I'm trying to say is that we have much more killer infection like TB for a country like India. Still, luckily, because of this use of mask, what people experts are saying now is that now we may get rid of TB by 2025, which we could not do in the last 4 or 5 or 6 decades. We have very good government programs are running to eradicate and control TB. Very effective programs, but still everything has failed, and we are still losing. Almost 45,000 people every month we lose because of TB in our country. 5 million people, 5 lakhs people per year. Okay, so I think TB is much more dangerous, much more common. But it's a new disease. COVID was a new disease which was not there. And for people in Europe and US, they don't get infections. Their morbidity is through non-communicable diseases like heart attacks and strokes and cancer. So they got scared, and we followed the same thing in our India also. But India, we have many other bigger killers than COVID. But of course, any death is not good, whether it's COVID death or non-COVID death. We have to prevent all.
Yeah, thank you. That's a very elaborate answer that you have given. My last question is, the statistics that has been getting reported for the past months during this COVID lockdown period is only due to COVID deaths. I was wondering whether the epidemiology department doesn't include the deaths due to other causes, which happens anyway, even if there is no COVID. What does this number really state? Are we playing gimmicks with statistics?
Yeah, I think again it's a very, very important question. And then, of course, we can't believe China, but in China last year, in the beginning when they had this COVID at the peak, so they came out with the data, the causes of death. In that, among all the causes of death in China, COVID was at 49 number. So there are 48 other conditions that killed more people in China than others. And I'm sure in our country also figures may not be so different. Definitely COVID does not come in the first 5 or 6 causes, which are still heart attacks, strokes, cancer, road accidents, suicides. Even suicides kill more number of people than COVID. That is totally preventable disease. And road accidents, we lose so many people per day. Every second we are losing people due to that. But so whenever we show statistics, we have to show top 10 causes or top 20 causes. If you show only one disease, then we lose the perspective. People start fearing COVID. But
so here also you have the top 10. Everywhere you have the top 10 statistics.
Yes. So people ride a two-wheeler without helmet. They get drunk and drive a two-wheeler. So those things are bigger killers for our country.
Yeah, thank you, Dr. Sudhir. I hope we received some few questions from participants. We'll go for the questions from the participants.
Thank you so much, sir. Dear friends, it's a time for your questions. You can make the session more interactive by asking your questions. Come on, friends, you can ask the questions.
So good afternoon, sir. This is Santosh ME from 2nd BSc Biochemistry. I would like to ask a question, sir. Whether COVID-19 can be transmitted through food, is there any possibilities?
Okay, see, I think, it depends on what food we are talking about. If we are talking about, let's say, cold food, like say salads, or, something which is not cooked, then there are very high chances because, as I said, the viruses can survive for up to 3 hours, in a normal temperature, not very hot, not very cold. So if somebody has had COVID and he's handling the food, let's say salad, which is not cooked, and then you have it in the next 3 hours, there is theoretical chance is there. But if it is a cooked food, let's say, somebody, I think possibly what you are talking about is when we order from, things like Swiggy and Zomato, then are we going to get COVID or not? So there the food is usually cooked. You'll order some pizzas or, some biryani or something, which is already cooked and packed. And then obviously, if you handle the packaging, and then you have to, sanitize your hands. And then inside the food, if you have, there is no risk. So cooked food, risk is not there. Uncooked raw food in the first 2 or 3 hours, there is a small theoretical risk is there if the person who handled the food is COVID positive.
Yes, sir. Thank you, sir.
Good evening, sir. I'm Nityashree from 3rd BSc Biochemistry. I would like to ask a question. Why the CRP level is elevated in the COVID-19 patients, sir?
It's a very good question. As I mentioned, CRP is a non-specific marker for inflammation, not infection, but inflammation. So C-reactive protein. So infection also is one of the causes for inflammation. We have other conditions like autoimmune diseases, even certain malignancies. So CRP elevation means that the person has an inflammatory condition, and in this case, it happens to be COVID. So if you find high CRP, it does not mean COVID. It means that patient has an inflammatory condition. And if a person is COVID positive, then we attribute that high CRP to COVID, that the person is in the still active inflammation phase. And if it is in the second week of illness, possibly we need to use steroids. If it is in the first week, then we know infection also can cause high CRP. So then we treat the infection. We don't have too many drugs which are proven, but yes, we have few drugs which can be used to kill the COVID viruses.
Okay, sir. Yes, sir. Thank you, sir.
Good afternoon, sir. This is Sai Krishna from 2nd BSc Biochemistry, sir. I would like to ask a question, sir. Will there be any future complications in people with a history of diabetes or heart-related problems who have been infected and treated for COVID-19, sir?
I think again it's a very important aspect. So basically you're talking about post-COVID scenario. So person got COVID, now recovered, and will there be something left over? Answer is yes. So we are already seeing what is called as post-COVID complications in many patients, and those who are already having a pre-morbid condition like they had diabetes or heart disease, obviously they'll have much more symptoms. But I would like to even tell you that even if people who had no other conditions, no symptoms also, the viruses can enter the heart muscles, what is called as myocardial muscles. And let's say if somebody was an athlete who was running 5 kilometers or 10 kilometers daily before getting COVID, if you ask the same person to do 5K or 10K runs, they will get fatigued. But fortunately, this kind of cardiac muscle involvement doesn't last for too long, and in a younger persons they recover in a month or two. But some people do have residual symptoms for 3 months also. So just because somebody has become COVID negative, they don't bounce back to normalcy immediately. But those who are fit, those who have been used to doing gym workouts or swimmers or cycling, so they tend to recover much faster than people who are totally sedentary and not exercising, things like that. So some variables are there.
Thank you, sir. Thank you.
Good afternoon, sir. I'm Vaishnavi from 2nd BSc Biochemistry. How diabetes is a risk factor because it is a disease of hormonal imbalance. So how it is linked with COVID, sir?
Okay, so diabetes actually is one of the conditions that reduces or lowers our immunity. If you look at diabetic complications, of course, on one side we have syndromes like heart attack or kidney damage and strokes, but also one side diabetics are prone to getting all many infections. In that, common things are pneumonia, UTI like urinary tract infection, and what is called cellulitis, where they get infection in the legs and the feet. So diabetics are prone to get infection because diabetes also lowers the immunity, and that is how it's not specific for COVID. They're prone to get any infection, and COVID is one of the infections.
Thank you, sir.
So, good afternoon. This is Sneha from 3rd BSc Biochemistry. So, first of all, I would really like to thank you for your presentation. And my question to you is, sir, apart from following the necessary precautions like wearing a mask and maintaining distance and using sanitizers, sir, is there any particular diet that we should follow?
I think it's a very important part because in our body many things happen because of diet only, and so diet basically we need to have a diet which is balanced. It is rich in protein, low in carbohydrates, low in fat, and there are also some proof about certain foods that contain vitamin C, because we know that vitamin C is a natural immune booster, and containing lemons or oranges, they also will definitely help. Even this seed based diet also, like which are rich in omega, they're also good for us. So there is nothing specific, but these things have been shown to improve outcomes in people with COVID, and also high protein diet, especially because, as I said, muscle weakness is very common in many of these patients, and so high protein diet and some natural immune boosters which contain vitamin C rich foods, they are also useful.
Right, sir. Thank you very much.
And your voice is muted, Sai Darshini.
Can you hear me now, sir?
Yes, yes.
Thank you for the questions and thank you so much, sir, for your lucid and insightful answers.
Thank you very much.
Yes, sir. It's a pleasure. Gratitude is a language of the heart. I now request Dr. P. Indumati, Assistant Professor, Department of Biochemistry, to deliver the oath of thanks. Please, ma'am.
A very good evening to all. It is with immense pleasure here I am to deliver the vote of thanks. First and foremost, I thank Dr. Sudhir Kumar, the invited speaker for this day, for his wonderful presentation on COVID-19. It was as said in the introduction, he has simplified the concepts, that which was easily able to be comprehended by the undergraduate students as well, which was quite evident from the questions raised by these students. We also thank and owe immense gratitude to the management, the secretary, the principal, the head of the department, and my own colleagues who have helped in this program to make it a success. Thanks to all the participants also for your active participation. Thank you all. Have a nice day.
Thank you, everyone. Bye.
Thank you, ma'am. Hope you all enjoyed the session. Have a pleasant evening. Thank you. Stay safe.